3 years ago, Portland's only sobering center closed for good. Since about 1970, it was a place where police and firefighters could take folks who were too drunk for their own good, and they could basically sleep it off in a safe place. But over time, the folks who ended up there were not just drunks. Some had mental illness, and some were about to overdose on drugs, and some had aggressive behaviors, and some were just psychotic. So in 2020, the place closed. And since then, most of the people who used to go there now end up in hospital emergency rooms or jails, or maybe sometimes they're just left on the streets. It's why County Commissioner Julia Brim Edwards says a new sobering center is an urgent need.
It's very much needed. In fact, the last year it was in operation in 2019. More than 5,000 people received services, really to keep them safe and also to keep our neighborhood safe. When people are in crisis, they need someplace to go, and it needs to be open 24/7.
Brim Edwards said she's talked with police and firefighters and Portland street response folks, and all agree that the city needs a place where people in crisis can be taken, where they are safe and where the community is safe as well. Commissioner Sharon Myron agrees.
A sobering center is urgently needed, and that's not coming from my perspective as an elected official. It's coming from my perspective as an ER doctor who regularly sees people with addiction issues coming into the emergency department, and as a volunteer with Portland Street Medicine, going out and providing medical care to people living outside.
Okay, well, that sounds pretty simple, eh? I guess we're getting a sobering center. Well, wait a minute. Multnomah County, not so much. Multnomah County is deciding tomorrow how to spend an extra $60 million in tax money that it did not expect to have when it drew up the current budget. So you would think that it's a no-brainer, but oh no, it's not. Turns out the county chair, Jessica Vega Pederson, has zero money set aside for a sobering center in her proposal on how to spend that $60 million. Instead, she's spent the money on things for people after they've gone through that crisis. It would include things like a 30 to 60 day stabilization center for people leaving drug withdrawal programs or sobering programs, short-term transitional housing with recovery services, and recovery-oriented permanent supportive housing. I wanted to talk with the chair, Jessica Vega Pederson, about this today, but she was not made available. However, the Oregonian newspaper reported that Vega Pederson believes her plan will fill an important need. And it quotes a statement from her as reading, "The holes we are plugging with a stabilization center, transitional housing, and recovery-oriented housing are key investments, and they come on top of our healthcare partners bringing online 17 sobering beds. With these investments, we can move people from crisis into care and onto stability, both immediately and longer term." A statement early this evening also came to us from her office and suggested the move is supported by a large committee that recommended funding those back-end services first. The committee is called Beacon. Vega Pederson's plan would cost about $13 million. Brim Edwards and Myron, the other two commissioners who want the sobering center, they estimate their plan would cost between $10 and $15 million. And they hope for more money from the city of Portland to kind of match what they're putting in from the county. Both will argue for it tomorrow during the county board meeting. Brim Edwards says she hopes other commissioners will join in and support them.
And I know that having talked to my colleagues is none of us wants the options to be for somebody in crisis to be jail, to be left on the street, or to send them to the ER room, because those aren't places where they're going to get the services they really need.
Going back to what you were saying about the front door, I think to most viewers, it's just an obvious thing. You need to have a place to take these people. It's not right to take them to the hospital or to leave them on the street or throw them in jail. And yet a city of our size does not have this. How can that be?
Well, we did have it. In the 90s, approximately 15,000 people a year had the benefit of a sobering center. In fact, as recently as 2019, about 5,000 people a year had the benefit of really keeping them safe and our communities safe. And so, during the pandemic and the aftermath of that, as we come out of recovery, it absolutely makes total sense to be looking at how do we restore this very critical need.
So we'll be watching to see how these things shake out and how Multnomah County decides to spend its extra tax money. It's all going to happen tomorrow. In the meantime, what do you think? Do you think a sobering center is needed first, or do you agree with the chair's proposal for resources on the back end? Let us know, will you? You're great about sending us your thoughts and email. The address for the email is thestory@kgw.com. If you don't want to email, you could also call and leave a voicemail. That number is 503-226-5090.